Hello, everyone, and welcome to our first CAQH core participant call of 2018. My name is Jessica Porras, and I'm the Senior Manager for Education and Outreach. Today's webinar will focus on the CAQH core report on value-based payments. But first, I'd like to mention a few logistical items. You will be able to download a copy of today's presentation from the CAQH.org website tomorrow. Also, a copy of the slides and the webinar recording will be emailed to you in the next day or so. We will save plenty of time at the end of today's program to respond to your questions. I encourage you to submit your questions at any time during the webinar by typing them into the questions panel on your dashboard. We have a lot to cover during this webinar. We will start off with an introduction to value-based payments and share the work CAQH Core has been doing on this subject. We will then share a first look at the report and go through the opportunity areas and recommendations. Finally, we will talk about next steps and how you can get involved. We're going to do some polling throughout the webinar to get information from you all, our participants, so we can better represent your perspectives and needs. Here's our first polling question on the next slide. Let's go ahead and launch this poll. We want to get a feel for what your stakeholder type is. So let's just take a few seconds. If you could please respond. Are you health plan payer, provider, vendor, clearinghouse, or do you fall into the other category? We'll give you a few seconds to respond. Okay, let's give this 5 more seconds and then we'll share the results. Okay, let's go ahead and share the results. So this is who's with us here today. Thank you so much, and this will be very helpful for us because it'll help us address the right audience properly. So let's get started. I'd like to introduce our first speaker, CAQH Core Director, Erin Weber. Erin, welcome.
Thanks, Jessica, and good afternoon, everyone. We appreciate you taking the time to join us. This is a special call today that we are holding for our core participating organizations. We have spent the last 2 years doing some extensive research into value-based payments, and particularly around the operational components of VBP as it's being implemented across the industry. So we're really excited to share a sneak peek of the findings with you, and we'll talk more about next steps towards the end of the presentation, but I encourage you all to get involved. We're going to talk in a minute about your role at your organization, but traditionally CORE has worked largely with individuals at our organizations that are engaged in the administrative side and the administrative transactions in healthcare. So as we move into this new area, I would ask you to kind of think more broadly about who from your organization might be interested and might want to get involved in this initiative. I think it's a really great opportunity, and we've unearthed some great opportunities for the industry to really come together to make VBP successful moving forward. So with that, I'm going to start on slide 7 with just a little bit of a level set on value-based care and value-based payments. Value-based care is a healthcare delivery model in which providers are paid on patient health outcomes. And then value-based payment within that is a strategy used by purchasers to promote quality and value of healthcare services. So the whole concept here is that by paying for value, the result will be better care for individuals, better care for populations, and lower costs across the industry. We have seen quite an uptick in value-based payments over the last few years. About 30 to 50% of providers are reporting they're engaged in VBP, and it's expected that more than half of healthcare payments will be value-based by 2020. Some of these programs are seeing cost savings and quality improvement as well. Value-based payment is a hot topic with lots of moving parts. CAQH Core's focus in this area has been largely on the operational components of value-based health. And so we'll move to the next slide. As you think of the industry as transitioning from fee-for-service to value-based, There's sort of a range of models within the scope of what value-based payments mean that are being implemented across the industry, from pay for performance, which is less risk, to full risk models that are really related on outcomes-based payment. This transition to VBP, though, is not without challenges, and that's really something that we need to think about moving forward. Improvements in operational capabilities are really important to ensure success of these various models. Back when the CAQH core first started, the industry was seeing lots of variation in how the administrative transactions for billing and claims processing and eligibility were being implemented across the industry, which made it very difficult for providers to automate their systems. As we're moving into this new world of value-based payments, similar challenges are arising on the operational side. We're seeing proprietary systems and processes being implemented and introducing operational variations, setting up a scenario right for repeating some of the things we saw back when CORE was first founded. The transition to value-based care may slow if providers are encountering barriers to participate in these plans and they are looking for an efficient, uniform operational system to support them. It's important for the industry to collaborate now to standardize and coordinate operations before proprietary systems become entrenched in our processes around value-based payments. And that really is the message of the report that we plan to release in the coming weeks. So before I get into the details of CORE's work specifically in this area and the findings from the report, I just want to get a sense of who is on the phone today. What is your role related to value-based payments at your organization? And we have a couple different options up here for you to consider. And we can go ahead and put up the poll. Are you management and oversight, working in contracting and relations with providers and plans? Maybe working on claims adjudication, reconciliation, quality measurement, or other or not applicable. This is a topic of interest for you, but not necessarily directly related to your position. So I'll give you guys a couple minutes to respond. And I think we'll go ahead and show the results. And this goes back to the comment that I made earlier. To date, our relationships with our core participating organizations have really been with those individuals implementing fee-for-service payment. The findings here are demonstrating that many of you are not directly involved in value-based payments, or tangentially involved. So again, I would encourage you as you listen to the findings today to reach out to those within your organizations that are working directly on these areas, encourage them to get involved in the work that we're doing. So with that, I'm going to move on to slide 11 to talk a bit more in detail about CAQH CORE's value-based payments initiative. As you are all core participating organizations, you are well aware that for more than a decade, CORE has brought healthcare stakeholders together to develop and agree upon operating rules to improve the exchange of electronic transactions. 4 phases of operating rules have been developed. We've worked with the industry. Many of you have participated in our subgroup and work group calls where you hear providers and plans and vendors all trying to come together to find solutions around how to streamline payments and claims processing and prior authorization challenges in healthcare. Similar challenges are creeping up in value-based payments. And so we really feel like by collaborating now and applying some of the lessons learned through the work the industry has done in the fee-for-service space, we can energize an effort to ensure that this shift from volume to value continues and is unimpeded by administrative hassles. Slide 12 gives a little bit of a timeline of our work in this area to date. Back in 2015, the CORE board, a multi-stakeholder group composed of equal parts providers and health plans with vendor representation as well, came to an agreement that the focus of CORE moving forward must be on both driving unnecessary costs from fee-for-service data exchange and also helping collective exchange needs for value-based payments as well. So that board decision really launched into a broader effort to conduct extensive research on opportunity areas where the industry could come together on these topics. Many of your organizations participated in this research through interviews and through participant surveys, and findings from the research were then reviewed by many experts, including subject matter experts from core board organizations. The next step in this effort is really kind of where we are right now, which is to build industry awareness around the challenges and opportunities regarding the operational components of VBPs. We have been conducting an ongoing industry education series on value-based payments to help our participants and the industry understand some of the models that are out there, some of the challenges that are out there, and that will continue throughout this year. In addition, we have been developing a report, which we have mentioned, which outlines the findings from the research we have done over the past year and a half. And we are sharing these findings widely across the industry. I'll talk about next steps in a while, but as I mentioned, we anticipate publishing the report at the end of March and continuing the education series. And additionally, launching an advisory group to start working on some of these issues to identify some implementable solutions to address some of the challenges the research unearthed. So I will pause right there, and we'll now transition into some of the opportunity areas and recommendations that came through the report. And my colleague, Lena Geber-Mariam, CAQH Core Associate, will be assisting me in this conversation that we're going to have around what are the opportunity areas that we have found and some of the strategies that the report recommends for the industry to address. So first I want to start on slide 14 and just kind of give an overview of the report itself. Again, it really the point is to address this kind of VBP standardization challenges. You know, the industry is dependent upon smooth and reliable business interactions, and as there are consistent expectations and rules of the road, everyone benefits, and we've seen that on the fee-for-service side. You know, one of the most common themes echoed through the research and in conversations we've had across the industry is that currently non-uniformity is the norm in value-based payment operations. And so we're really working to change that in a way that is meaningful for both providers and plans. The report outlines 5 opportunity areas, which Lena and I will talk about in just a minute, along with 9 recommended strategies to address these challenges. And it identifies more than a dozen candidate organizations. I want to emphasize and take a minute here to talk about the fact that this is not a report about what CAQH Core can do related to value-based payments. I think there are certainly areas that Core may take the lead on, or Core could partner with other organizations to help address, but this is really a call to action for the whole industry. And in many areas, there are other organizations and collaboratives already addressing some of the challenges that are outlined in this report, and we certainly applaud those efforts and encourage them to move forward with their work. Slide 15 gets into the detail of the research methodology that is behind these opportunity areas. You know, we started with conducting a great deal of secondary research. We looked at all of the terms and trends associated with the varied value-based payment models, and I can say we could probably write an entire separate white paper on the variations in terminology within VBP alone. And so just trying to set the stage with some consistent terminology for the interview process was definitely a challenge. We conducted literature reviews and really confirmed the need for streamlining administrative processes and proposed a list of opportunity areas. We then conducted structured interviews with more than 20 multi-stakeholder entities and many core participating organizations to confirm or refute or add to these potential areas of action that came up from the secondary research. And then we asked you all, the core participants, to give us feedback on the interview findings. As always, it was very thoughtful and robust and contributed significantly to the opportunity areas. So with that, I'm going to turn it over to my colleague, Lena, to talk about what these 5 opportunity areas are that came out of the report and begin to give an overview of each opportunity area. And she and I will kind of go back and forth in terms of discussing, describing the industry challenge and then walking through the strategies included in the report to address the challenge. Lena?
Thanks, Erin. If we could go to the next slide. As mentioned earlier, our research identified 5 unique challenges to stakeholders undergoing the shift from fee-for-service to value-based payments. The opportunities listed on your screen are data quality and standardization, interoperability, patient risk stratification, provider attribution, and quality measurement. In the following slides, Erin and I will go into details to exactly what each of these opportunity areas means, as well as a preview of our recommended solutions and strategies as detailed in the report. First up, data quality and standardization. Stakeholders across the board who are participating in VBP models agreed that greater levels of data and insight are necessary for proper population health management. Perhaps even more importantly, this data needs to be available to providers at the correct time in the care continuum to be actionable and to improve patient outcomes. However, now we're seeing almost an opposite problem, where the industry is seeing this issue of too much data. In the effort of collecting as much data as possible, health plans providers are now left with sifting through these ample sources to find the necessary piece of information, and even upon finding it, are often left with inconsistent and incomplete data. You'll see here on slide 18 some examples, such as missing or inaccurate provider identification. While most plans require providers to submit their MPI on claims, when participating in VBP models, it's sometimes unclear as to whether the provider should supply their individual MPI, their group MPI, or even their TIN. This provider who's participating in a VBP model could also be participating in multiple models, which holds them financially at risk if their patient has an admission event. But each contract may define admission differently, from an inpatient stay to an ED visit or an observation bed. Erin?
Thanks, Lena. So that's the challenge that was unearthed in the research, and the recommendation is really twofold. The first is to promote and enforce data set and data element standards that would benefit VBP execution, especially where federally mandated. And this brings us back to the MPI, that the role of the provider must be clear to accurately disperse shared savings or shared risk. And accurate use of the MPI could really alleviate some of the challenges here in identifying physicians. The second is pursue voluntary agreement on adoption of applicable uniform definitions and, as needed, additional data elements in HIPAA-mandated transactions. This goes back to my earlier comment. There's a lot of terminology used, and it's not necessarily consistent across organizations. So consistent adoption of medical and non-medical code sets, uniform use of definitions would really help to improve care delivery and care management capabilities and promote transparency for more accurate value-based payments. So with that, I'm going to pause and ask for your all's feedback here on your opinions on this topic. So from your perspective, what poses the greatest data quality and standardization challenge for VBP? And you can check all that apply here. Non-standardized data, lack of data quality, so this refers to accuracy, completeness, or timeliness of data, inaccurate or missing provider identification, inconsistent use of common terms, or is it something else? And if it is something else, we'd encourage you to include your comment in the questions panel. So we'll go ahead and open the poll. We'll just wait a couple more seconds for people to get their responses in. And for me to take a drink of water. Okay, I think we can probably close the poll now. And what we're seeing here is and hopefully you all can see the results now, it's really varied. But that inconsistent use of common terms is really the front runner in terms of challenges. And so I think if the industry can come together and identify some best practices around these terms, it would really benefit the operational components of VBP. So I'm going to turn it back over to Lena on slide 21 to talk about our next opportunity area.
Thanks, Erin. Our next opportunity area is that familiar challenge of interoperability. Let's say we do get our data clean and consistent. Stakeholders still need to be able to access that information in a timely and efficient manner to allow real-time, actionable information to reach the point of care. VBP requires new and complex process capabilities to deliver patient management information at various points during this episode and make sure that that information is accessible to all parties involved. However, currently, patient information is often kept in disparate systems, from the EHR to the practice management system to health plan portals, and oftentimes handwritten clinical attachments. Researchers identified the need for improvements in this kind of technical operability, but also in process interoperability, such as common expectations for workflows and data timelines. Next slide, please.
Thanks, Lena. And so the recommendation in the report here are twofold, and I want to take a step back and say, we recognize that there is a lot of work being done in the industry in this space, and so the recommendations are both around promoting technical interoperability by encouraging the use of existing and emerging standards and technologies, and recognizing that a fully interoperable EHR system capable of sharing longitudinal patient-level data would dramatically advance VBP. These interoperable systems need to support more fluid and timely data interactions, which would really then impact the value of many other components that we're going to talk about today, like quality measurement, patient attribution, and risk adjustment. Lots of work being done here. I think it's just a matter of the industry kind of coalescing around an approach. The second area, process interoperability and cataloging best practices here. So thinking about more carefully choreographed workflows, processes, and policies to allow stakeholders to make more reliable comparisons and act on timelier insights, both from a quality and payment perspective. So next polling question, and you'll notice the trend here, we're going to ask a question after each of these opportunity areas, so we really appreciate your continued engagement. But we're curious from your perspective, what poses the greatest interoperability challenge? Is it technical interoperability, the inability to pass data from one information system to another while maintaining accuracy and validity of the data? Or process interoperability, lacking common expectations for workflow, connectivity processes, data timeliness, et cetera? As you can imagine, probably working across different plans and providers implementing these models, this can be a real challenge. Or again, is it something else? And I'd ask you to elaborate in the questions panel. And I comment that in early research, two other types of interoperability came up, and that was semantic interoperability. And again, that gets back to the terminology challenge about what we say, and when we say, does it mean the same things to each other? And policy interoperability. So are policies the same and consistent for the same models across organizations? Not quite as high on the list once we vetted it via research, but certainly other issues that came up here. So we'll take a look at the survey results. And it looks like overwhelming thoughts that process interoperability might in fact be the larger challenge in this space compared to technical interoperability. And I think that's really interesting because I think you hear about technical interoperability a lot more in the industry on this topic. But that processes really do make a difference when it comes to implementing some of these models. And so moving forward, I think that's going to be really useful feedback as we tackle some of these challenges. I'll turn it back to Lena to introduce our next opportunity area.
On this next slide, we see the challenge of patient risk stratification. Patient risk stratification is critical to success of VBP models. Providers must be able to determine who is in their population and needs a larger share of time and resources. but also know how a health plan will take a patient's current status into account for their final financial outcome. To participate in VBP models, stakeholders design interventions that target high-risk, high-cost patients who need to be carefully and proactively managed to improve the overall health of the population. These models are either prospective or retrospective, but each model weighs chronic conditions, social determinants of health, and other factors differently in determining which patients classify as low, rising, or high risk. Providers are often unclear how health plans are using risk assessment and whether risk adjustment tools are being applied to their patient risk stratification methods. Furthermore, even when plans are using a transparent method, each contract between a health plan and a provider may use a different methodology, further complicating the process.
Thanks, Lena. So from a recommendation perspective, again, we have two recommendations here. The first is to increase industry awareness of the threats of data inaccuracy and unavailability and methodology variation, the threats that these things pose to VBP operational success. And the second is to promote industry collaboration and transparency of risk stratification models and their content. So we're not naive enough to think that everyone's going to kind of open up their risk stratification models for the industry. I mean, certainly the total number of models is unknown. There's about 7 publicly available models that are based on various comorbidities, but there's not a lot of detail available, both about the cost analysis and the effectiveness of each model to guide industry best use. So I think as a first step, talking about some of the more effective methods behind risk stratification would be really valuable to the industry. And so there just becomes more awareness around the values and what works and maybe what doesn't have as much value as we move forward. So again, I would like to ask for your feedback. What poses, from your perspective, the greatest patient risk stratification challenge? Is it lack of transparency, so providers not knowing what patient risk stratification model a health plan is using? Or is it lack of uniformity, the differing methodologies used in contracts between health plans and providers? Or again, is it something else? And I'd love to hear what that might be in the questions panel. And I just want to thank you all for your engagement and continued participation in the polling questions. It's great to see that everyone is so actively thinking about these topics. And I think we can go ahead and show the results. I think these results show that, both are a challenge, but a little bit more on the side of the lack of uniformity. The different methodologies are really challenging across the industry to then also respond to, where a patient may be high risk in one and medium risk in another. And so coming together as an industry to improve that process, I think would have a lot of value. Now I'm going to turn it back over to Lena to introduce our fourth opportunity area.
Thanks, Erin. So number 4, provider attribution. In VBP models, attribution assigns accountability for individual patients to providers. Patients may be assigned to providers in a retrospective or prospective manner based on geographies or based on the previous relationship with the provider. Without understanding which methodology is being used, providers may not have total clarity into who compromises the population whose health they're supposed to be managing. A provider with 10 health plan contracts could potentially have patients attributed in a multitude of ways, and the logic behind the attribution may vary, causing erroneous assumptions and uninformed decision-making. Next slide.
So the recommendations here are kind of similar to those in the risk stratification category, and indeed the challenges are similar. The first is to improve provider awareness of patient attribution through clearly defined and accurate provider data. There's a lot of information that goes into attributing a patient to a provider, and ensuring that that provider's data is up to date and accurate is really critical for provider attribution to be successful. And so that's the first opportunity. And the second is to streamline and improve transparency in the use of the attribution models. Again, we talked to many of you out there in the industry, and there is a proprietary component to this. and that's important. But there are some ways in which transparency and understanding can be improved for the provider so that accurate quality and cost comparisons can be made to know whether the goals of DBP are being achieved. Next polling question. Again, your perspective. So what poses the greatest provider attribution challenge at your organization or what you've observed in the industry? And so the first option is lack of accurate data on assigned patients. The second is lack of timely data on assigned patients. So you might get the information you need, but at the wrong time. And the third is lack of transparency regarding the provider attribution model being used. Is it difficult to understand, or is it not clear? And then is it something else? Again, elaborate in the question panel. I would give it a couple more minutes, but there seems to be an overwhelming response for this one, and that is lack of transparency regarding the provider attribution model being used. So to the extent that the industry can come together and start to talk about what are the key components of attribution models would be a great first step towards addressing some of these challenges. And I'm going to turn it over to Lena one more time to introduce our fifth and final opportunity area for action, and that is quality measurement.
Thanks again, Erin. The success in VBP and the shift from volume to value-based payments is crux upon the ability to accurately measure the value that we're paying for. Even more importantly, providers need to be able to understand these measurements and turn them into actionable insights that can improve the health of the patient and overall population. With so many measures that providers must report on, the administrative burden can seem insurmountable with limited benefits. Many of these measures focus on processes or workflows that the provider must follow, rather than clinical outcomes or patient-reported outcomes. Next slide, please. Great. And so here we come to our last recommendation here, and that is for the industry to support efforts to address quality measure challenges and promote standardization by providing education to address the need to improve consistency in quality measures across programs, reduce quality measure data collection burdens, and require quality measures to be actionable. This is a great example of a strategy or recommendation in the report where, as I mentioned earlier, there are other candidate organizations, and in fact, one organization identified more than 30 such collaboratives working on some of the challenges around quality measurement. And so, in particular, this is probably not an area that CAQH Core would take the lead on, but there's lots more to do on this topic based on how frequently it came up in the research. So we applaud and would encourage those organizations working to tackle these challenges to continue to do so, and certainly support industry education around that as well. Again, there's a lot more information, and there will be in the full report on some of the recommendations here and specific strategies to address the recommendations. So we look forward to sharing that report with you later next month. But in the meantime, one more polling question, and this we'll kind of keep to ourselves, but as you've heard about these opportunity areas and know that we're probably going to dig deeper into some of them, would you be interested in a follow-up interview or a site visit? Or there's something going on at your organization that you think we should be aware of? If so, please indicate here, and we'll definitely reach out and follow up with you. We certainly rely on our core participants for driving our strategy and focus on various topic areas. Great, so we'll go ahead and close that poll. And I want to move on to talking about some of the next steps for CORE within the area of value-based payments. As I mentioned, the full report will be released in late March, and we will make sure to distribute it early to the CORE participating organizations so you have an early advance copy. Dr.
Sue Turney, who is the CEO of Marshfield Clinic Health Systems. She's also the vice chair of the CAQH Core Board. We'll be hosting an industry-wide webinar on April 10th with more detail and more insight into the full report, and probably also sharing many of her own thoughts on this topic. I know this is one that is near and dear to her heart. So I would certainly encourage you all to attend this session and share it broadly with your colleagues as you were listening to what you heard today. If there are others at your organization or colleagues in the industry that you know would be interested in this topic, we certainly encourage you to attend. And then slide 35 talks about our next steps in this initiative. And the key next step is to form an advisory group. And given all of those on the phone are core participating organizations, you may be very familiar with this concept. We used an advisory group to launch the work on prior authorization, and this was a smaller group of industry experts representing all of the relevant stakeholders that helped guide the focus of the prior authorization work. And this advisory group will do much the same for value-based payments. The group will be charged with narrowing down the list of potential opportunity areas. So if you think of those 9 recommendations, and then, like I said, there's more detailed strategies against the recommendations in the report, this group will use a set of criteria that they establish to determine which strategies CORE would pursue or pursue in partnership to help move the needle in improving the operational components of VBP. We recognize that that group probably needs to be higher level individuals at an organization that have insight into the various VBP models that are being implemented and how that is working across the industry. But they might not be in the weeds enough on the specific opportunity areas. Certainly, at many organizations, I know those individuals working on interoperability might be very different than the individuals working on risk stratification, for example. So the way we're thinking about modeling this, and certainly feel free to provide us offline feedback on this as well, is that the advisory group will kind of be an ongoing group that advises this group regularly, probably over the next year or two. And then we actually create tiger teams to tackle the individual topics that the advisory group prioritizes. And those tiger teams would be composed of individuals who are kind of on the ground working on the specific topic being addressed. And the goal of these tiger teams is really to help identify implementable solutions that the industry can use to help develop and increase uniformity and standardization in VBP operations. And so that is a model. We'll also continue our research and education throughout this time frame. But the advisory group and the tiger teams will really be sponsorable for the key deliverables. So if you hear that and you're interested in participating in any component of this, we would encourage you to reach out to us. You can either write something in the questions panel and or email us at core@caqh.org. So with that, I'm going to turn it back over to Jessica to moderate our Q&A.
Thank you so much, Erin and Lena, for your presentations. You did a great job of whetting our appetites, so we look forward to seeing the final report. We do have a few questions that have come in, but I'd like to remind you to please submit your questions by typing them into the questions panel on your dashboard. So the first question that has come in is, will core participants receive a copy of the report?
That's a very easy question to answer. Yeah, as I mentioned, we are planning to publicly release the report the week of March 26th, I believe is what we're targeting. And we would ideally share the report in advance with core participants directly. So if you, anyone on this call will receive a copy of the report. We have all of your contact information, so we'll make sure that you get that in advance.
That's great. Thank you, Erin. Another question has come in. Do you anticipate creating a tiger team for each opportunity area?
That's a great question. No is the answer to that. As I mentioned earlier, there are several areas on here where we know others in the industry are moving forward and tackling the issues, and we certainly support that. And then there are other areas which may not just be kind of in CORE's bailiwick. So it will be up to the advisory group to really identify which topics CORE will tackle specifically, and we'll move on from there.
That's great. So we've had a couple of questions come in asking when the report will be released.
Yeah, as I mentioned, end of March is probably when we anticipate that report being released.
Okay, great. So I'm pausing here in case anybody else has questions or a comment that they would like to make. I know that we have given you a lot of information, and if you do have questions or comments after this call, you know how to reach us. Erin just mentioned you can email us at core@caqh.org. So what we will do is we will give you a little bit of time back. We appreciate you taking the time to be with us here today. If we could go on to the next slide. As some of you may know, we've done a whole VBP webinar series. We started it late last year, and so those first two links there will take you to the webinars that we've already done on VBP. And in addition to that, we have the two upcoming webinars. We have an overview webinar on March 13th, and Erin mentioned a webinar specifically on the CAQH CORE VBP report with Dr. Sue Turney, and we're really looking forward to those two webinars. And we will also be hosting webinars probably every other month from here on out on this really important topic for our industry. So we could go on to the next slide. Once again, here is information about how to reach us. There's our website and our email, and we thank you so much for taking the time to be with us today. Have a good afternoon.